Today's meeting is a hybrid meeting, and we have some people in the townhouse and others participating remotely. If anyone joining online would like to ask questions, please use the raise your hand function or indicate in the meeting chat and I will alert the chair. The meeting is being recorded and published online after the meeting. Could all members leave their camera on but switch off their microphone when not speaking? I will now do a roll call and would ask that members confirm their attendance when their name is called so that this is clear in the recording and can also be recorded in the minute. Councillor Cook, Chair.
Good morning.
Shane Patwa, Vice Chair.
Present. Good morning.
David Blackburn.
Apologies. Good morning, everyone present.
Morning. Thank you. Mark Burrell.
Good morning, President.
Councillor Fairfield.
Good morning, present.
Councillor Gregg.
Present.
Richie Johnson.
Morning, present.
Councillor Malik.
Good morning, present.
Jim Curry. Did see Jim online. Yeah. Jamie Donaldson.
Good morning, President.
Amanda Foster. Joy Miller. Stephen Fryer. Maggie Hepburn.
Present.
Caroline Howarth.
Present.
Beth McAlpine.
Present.
Amy MacDonald.
Present.
Shona McFarlane. Phil Mackey. Fiona Mitchell-Hill.
Morning, present.
Debbie Eugen. Graham Simpson.
Good morning.
And we have apologies from Jenny Gibb. Thank you, Chair.
Thank you, Emma. Main item, several items on the agenda, the main one of which is the budget, and we all know the budget position is challenging, but I want to put on record my thanks to Amy in particular and to Fiona and all the officers who've done a pile of work on this. As I say, the position is challenging, but we're in a much better position than I thought we were going to be 2 months ago or even a month ago. So thanks, guys. A deal of work, really good stuff being done. I'd like to welcome Councillor Malik to his first meeting of the IJB, and although she's not here, record my thanks to Councillor Jennifer Bonsall for her constructive input to IJB over the last couple of years. I should also say that this is Fraser Bell's last meeting of the IJB before he goes off to join Aberdeen University, so the university's gain will be our loss. So thanks for all your hard work, Fraser, much appreciated. I should also say that this is my last gig as chair of the IJB, because as many of you will know, we rotate the chair every couple of years, and it's 2 years for someone from the council, and then it's 2 years for someone from NHSG. So I'll be handing the baton over to Hussein next month. Also just want to say it's been a real privilege and a pleasure to be chairing the IJB. Privilege because looking after the health and well-being of our fellow citizens seems like a pretty good thing to do. Pleasure because the stuff we talk about here I actually find quite interesting, and it's also given me the opportunity to meet a whole bunch of dedicated, very professional, nice people with whom I would be happy to have a pint in Mark Cameron's. Other hostelries are available, and please drink responsibly. Jim, did you want to come in?
Yeah, sorry, just to indicate my presence, I was having sound problems when the roll call was taken.
Fair enough, thanks. Yeah, so as it's the budget meeting, we won't be doing the normal video at the start, but we will be aiming to take the break, the usual break, once we get to 90 minutes or thereabouts. So that then is the end of my kind of introductory spiel. So agenda item 2.1 is declarations of interest or transparency statements. Hussein.
Thank you very much. Thank you very much, John. A number of transparency statements simply given the content of the papers before us and my intended line of questioning. I'll start with my usual ones. I'm a member of the Diverse Experiences Advisory Panel, which is a named partner in the Scottish Government's mental health and wellbeing strategy. I'm also the lived experience representative on the Scottish Government's mental health and wellbeing leadership board. With a different hat on, given the reference to chronic pain in the strategy, I am involved in a project with the University of Dundee, which is working to quantify the prevalence of people with chronic pain. I co-chair the Scottish National Action Plan Leadership Board on Human Rights, and I'm also the alternate designate on the Human Rights Incorporation Oversight Board. I don't believe that any of this precludes me from taking part today, but I mention it for completeness.
Thanks, Hussein. Any more? Maggie?
I'd like to declare an interest in item 4.4, grant funding for voluntary organisations. That includes my organisation, ACFO, so I'll take leave of the room when that's being discussed. Thanks.
Thanks for that. Any more? Can't see any hands. Okay. That takes us to determination of exempt business, but we don't have any exempt business today. And that then takes us to 4.1, which is the IJB membership paper, which is in the additional circulation in your packs. Do we have any questions on this one? Nope. In which case, I think it's fairly straightforward. So can we then approve the recommendations, which are to note the appointment by the Council of Councillor Malik and appoint Councillor Malik to the Clinical and Care Governance Committee. Can we agree that one?
Yep.
Thank you very much. That brings us to item 4.2, which is the main event, as it were, which is the annual budget report for 25-26. And if I can hand over to Amy to introduce this. Thanks, Amy.
Thanks very much, Chair. Just before I give a summary of the paper, I'd just like to highlight in 2B and 2C in the recommendations, on the third line down, that should read 2A and not 2.1.1 in both 2B and 2C. Thank you. So just to give a summary of the paper, we're presenting our budget today for the 25-26 financial year, where we're presenting our expenditure of £390 million. With our set aside funding, it brings that expenditure up to around £439 million. In order to deliver our budget for the following financial year, we would have to make savings of around £25 million. But the budget paper proposes and has confirmed around the Council's contribution to the additional £10.9 million worth of funding, which will support the IJB for the following financial year. Council budget sat at the beginning of March and approved the Council contribution. I've also spoken with the Chief Financial Officer at NHS Grampian, who's confirmed the allocation from NHS Grampian of the 6.7 million as part of their budget proposal, which sits on the 10th of April. Our budget proposal paper highlights the need to make £14.354 million worth of savings for next year. In pulling together those savings, we've looked across our expenditure and we've looked to see what savings we can make while protecting essential services for people of Aberdeen City. And particularly, we've looked across our staff costs, our commission services, our property expenditure, looking at how we deliver the supplier expenditure that we need to make in a manner that we feel protects those services in Aberdeen City. I'm confident in the delivery of those savings programmes, and we've started developing those savings. We're working as a team very much on that delivery, and we've set up the governance around that, which gives us confidence that those savings are very deliverable. We anticipate that the first quarter of the year, pretty much from now through to the end of June, will be a really busy period for us in making those savings and driving those forward into the next year, and will entail a significant amount of work for the team, but everyone's really focused on that piece of work. I'm happy to take any questions on the paper and provide further detail as is required.
Thanks, Amy. Any questions? I'm assuming there'll be some. Councillor Malik.
Thank you very much, Convener, and thank you, Amy McDonald, for your presentation, and I would like to thank all of your team for their hard work. I just have maybe less than half dozen question if it's okay, convener. Thank you. So my first question, you're asking us to agree a budget based on assumption that NHS will provide extra income of 6.75 million. But you qualify that position by saying we will require to hold another budget meeting after our deadline of 31st of March. If our request to the NHS is not met, would you not agree with me that it would be best to bring forward a budget without the NHS assumption rather than with the NHS assumption?
Thank you. So the NHS budget, it unfortunately doesn't meet before the end of March, which is the period that we need to set the budget for. If the NHS don't approve that additional funding, then we would require to find an additional £6.75 million worth of savings for next year. And that would mean that we wouldn't necessarily be able to guarantee the protection of essential frontline services. However, I'm aware from my discussions with the Chief Finance Officer at NHS Grampian that full provision for the funding that we're looking for next year has been made within their budget, albeit it's not approved yet.
Thank you very much for clarifications. Okay, so my second question. We need to make over £14 million of saving. How confident are you that the IGB will make those savings, and can you specify where those savings will be made as per 4.4 of the report? And what the high risk are for each of saving being achieved? I mean by high risk, what is likelihood of failure on each saving on scale of low, medium, high? For example, reduce bank nursing by £999,000. Is that achievable? And a likelihood of being achieved risk-wise high, medium, or low?
Thank you. The budget savings that we've put forward, I think, will have risk around them, but we feel that risk is low, based on the overall expenditure target, the overall expenditure we make across those categories, particularly on our bank nursing costs. And we spend our annual budget for bank staff, for nursing staff is £47 million. We spend approximately kind of another 10% on bank nursing costs across that, so around 4%, around £4 million additional bank staff costs a year. We're looking to target 25% of that additional cost, and we've already started looking at the areas where we can really make good inroads into making that saving, so we're really confident that that number is achievable. Across the rest of the savings, we've already started the work around those, and we're looking at a number of different areas to develop those savings, so our confidence is high at this time. If we didn't have that additional funding contribution from both the council and the NHS, our savings challenges would be much higher, or they would be of a higher risk, and that they might not be as deliverable. But at this level, we're confident in bringing forward those savings over the course of the next year.
Thank you very much, and thanks, Kinera. So you feel the risk is low, and based on just assumption or based on your statistic and calculation?
So we put in a lot of work when we reviewed the budget, and what we've done is we focused on our highest areas of expenditure, and it's those areas that we feel most confident that we'll be able to bring forward savings and protect the delivery of the essential frontline services within Aberdeen City. I would say it is a lot of work to save over £14 million in the year, but we're definitely all geared up to do that. And I think the discussion amongst the team is strong. The areas that we're going to be looking at the savings for, the work that we're doing as a team, if you like, even how we have presented those savings in a project plan delivery format, and that gives the team great confidence And as we go forward and develop our budget, there's going to be really good visibility each month on how we're performing against those targets. And I think that also is really important, because you can see then how you're performing in a month. You can identify where you may have issues, the fact that you can get on top of that straight away, and we can bring that confidence forward that we absolutely are dealing with what we have at hand, and we've got a really good process for doing that. And I think that raises our confidence of being able to deliver those savings that we've put forward.
Excellent. Thanks very much through yourself, convener. So you say the budget for 2025-26 and the following 3 years underpins the delivery of the draft strategic plan 2025 to 2029. The medium-term financial forecast recognizes the focus of improving health outcome in Aberdeen City. Whilst nobody can disagree about the focus being of improving health outcomes in Aberdeen, but would you agree with me the strategic plan will require to look a lot different if our partner fail to support our spends?
So we are working very closely in our strategic plan. We've reviewed it. Alison has led on this for us and has done a significant amount of work, absolutely taking a financial lens to it, which probably is a renewed focus from where we have previously been with our strategic plans. So I think I would like to give confidence that we are absolutely looking at the strategic plan to ensure that we can deliver within the financial envelope that we've got.
Thanks very much, Fiona, for your clarification. My last part of the question, can you answer in relation to overspend?
So the way that I've presented the medium-term financial forecast is that we would have, if you like, a deficit in each of the future financial years. The integration agreement that we have for the partnership says that if you have a deficit, we would look for partners to fund that. So we've at the bottom of our table, we've put what the partner contributions would be in future financial years. And whilst that's not guaranteed, that's where we would look to make the budget balance. Alternatively, I could present the table so you could see, we could state that that's what our shortfall would be in future financial years, and that's where and then we'd be looking to seek that funding from partners.
Thank you. To yourself, convener. So you say that 40% of our national insurance is unfunded. Can you confirm that Scotland received a record settlement from the UK government in excess of £5.4 billion, and that Bannock formula fully covered the NI contribution?
That's it. Certainly, the budget that we've brought forward for next year is based on the information that I have been given. I'm aware that both NHS Grampian and Aberdeen City Council receive 60% of the additional employers' national insurance contributions, and that leaves a 40% shortfall in our budget. That's one of our budget pressures, and we've obviously got the savings that are set around that so that we can bring forward a balanced budget.
Thanks, convener. My last question. In the strategic plan, you say you want to follow Marmot, but where within this budget can real saving be made by following Marmot and following prevention and early interventions actions?
I think the 25-26 budget is, if you like, our most significant year within our next 4 years of forecast. We have to make more, this level of savings is obviously a lot higher than we have in future financial years. Our savings going forward are based upon being more on top of the prevention agenda and the early intervention agenda. Certainly my medium-term financial plan links directly into Alison's presentation of our draft strategy document. And I think that what we have to recognise is that we need to change as an organisation. We understand that healthcare is more expensive to deliver, and that if we keep the model that's the same as we've got just now, each subsequent financial year becomes more and more difficult to deliver. if we're able to prevent people becoming unwell and keep their health strong, and it's a number of factors that go into that, we feel we'll have a healthier population that is less reliant on care into the future. And our future plan is based around really pushing forward our opportunities for example, technology-enabled care, being able to really push forward. For example, we mentioned our vaccination programme, being able to help child health and keep people well for longer. I think these are really positive things that we've got the opportunity to do, and that gives us greater confidence in future years that we can move to being more financially sustainable.
Excellent. Thanks very much, Ms. McDonald.
I got Richie first.
Thanks, John. And yeah, just to echo your acknowledgement of the work that's been done to get to the paper brought before us today, and equally, I guess, just to recognise the challenge that lies before us in the months and years ahead. And it's not, well, the paper is for 25-26, so I've got no doubt that this is about setting the tone, if you like, for future years as well. So that kind of longer term work and sustainable, transformative work is really important to follow on from that. A couple of comments and a couple of questions. You covered a fair bit in your introduction that offset some of my other questions, so thanks for that. I guess just to recognise also that Audit Scotland last year noted that IGBs across the country face a complex landscape of unprecedented pressures, challenges and uncertainties, and whole system collaborative working is needed nationally and locally. That's their words, not mine. So I think it's worth us just acknowledging that, just in terms of the context that we're working within. And also welcome the paper's focus on protecting the most vulnerable in Aberdeen. That's a really welcome approach. And remiss not to acknowledge the additional contributions from Aberdeen City Council and also the expected contribution from NHS Grampian, acknowledging that needs to be formalised in a few weeks' time. In terms of the plan and that monitoring, Amy, you talked through, I think that equally is really important for us as a board, just to make sure we are aware of progress against the savings plans and scrutinise that that's being delivered. So again, I welcome that kind of regular check-in and that early focus on if things are starting to go slightly askew, then how do we address that? How do we make sure we don't fall behind the curve, if you like? And just on that, I think I did take from your comments that the savings are planned for 25-26. I guess the timing of when those savings starts to apply, whether some will be 1st of April, others might be 1st of June later. So I guess just some assurance that's been factored in terms of when that starts to apply. I have seen that you can put forward an annual budget figure, but actually the savings don't sometimes start happening until 6 months in. So that just, I guess that granular kind of approach about exactly when the savings kick in would be welcome to be assured around. And also the one of the risks that you've recognised is the current year's position, the outturn for this year, and how that might impact next year's budget assumptions. So again, any additional comment you've got in terms of I guess the best advice you can give us just now in terms of where we're likely to be at the year end would be helpful, just again so we've got that heads up in terms of the impact for next year. And final questions around early intervention and prevention. I think Councillor Malik alluded to that as well. Just that, I guess, assurance maybe through, this was maybe more for Fiona, that we've got in terms of the budget, we've got that balance right in terms of protecting the most vulnerable residents, but equally that important part about prevention and early intervention needs to go hand in glove with that. So any comment on that would be welcome as well. The final thing, just to note that the integrated impact assessments, so they're really detailed and well set out, so it's worth just recognising that too. Thank you.
Great, thanks, Rich. Yes, I'll just go through the first the questions. So budget phasing, I think, is really important for us. Ideally, in an ideal world, I'd like to make all the savings in the first quarter of the year. Realistically, we'll phase those throughout the year. But what we will have, the budget typically in the system is kind of evenly weighted throughout 12 months of the year. We'll be more sensible around our budget weighting. I think that's really important for budget holders, so they can actually see what actions they're taking and what the outcome is, and be able to better understand where they've got budget variance. That's something that would be a real plus for us in doing that. So the budgets that's loaded into our ledgers will be absolutely in line with our savings profiles that we're developing just now. And that helps reduce risk of delivery. Then, if you like, our 24-25 year end. So we've just reached the end of, well, I say just reached the end of February. We're well into March now. And we've had overs and unders, as you would expect, at the end of February, but we're still holding towards our 24-25 outturn position. The only area of risk I'm really carrying just now is across the commission service providers. That was really quite difficult, I think, at the end of last year, and we've done a lot of work on that this year. But I think from a risk perspective, I still see an amount of risk there in terms of we have absolutely estimated what our costs are likely to be at the end of April, but that estimation may be good, may be bad. So I still have a little bit of risk around that we haven't completely ironed out, but we're doing all that we can to make sure that we're in a really good position at the end of the year, and certainly the ups and downs are kind of matching out at the moment, which is a real positive. And then looking at the planning ahead, you know, the 26-27 budget is, I know we're talking about 25-26 just now, but certainly it's at the forefront of my mind. Even as we move forward, I think we'll be really busy the first quarter. And as we get through that piece of work, it's really picking up, then kind of running in parallel what we're looking at in 26-27 year, which needs a little more planning, because we're looking at, I think, probably more, I would see it as more positive change, where we're looking to change the infrastructure that we've got around delivery, being able to reduce that cost base in a manner that doesn't involve perhaps the savings that we're going for this year. They're at a different level, and we want to really start pushing the opportunity for prevention, particularly looking at technology-enabled care. We will do some of that this year. We've got a funding application in with Scottish Government just now, which fingers crossed will enable us to develop applications which will be really helpful for the future of managing our care provision and really understanding the effectiveness of those prevention actions, so we can really push those forward into the future. And thanks, note your comment on the IIAs.
Mark and then Martin.
Thanks very much, and thank you for the paper. It's no surprise to you that I'll come to the pharmacy prescribing budget. It's one of my topics. 5% overall increase. Can you just give me some information about what you're doing to bring that down? It seems to always climb every year, and it's obviously a fairly big impact, £2.5 million. And that's one question. And the other question I'd like to know, and I haven't done the maths on it, is what's the percentage of our overspend compared to our budget? Sorry, I haven't done the maths on that. I'm not sure if you have or not either. Thanks.
Yes, I'll take prescribing first. So prescribing is an area where we're very reactionary just now. We see 3.5% growth in prescribing costs this year. We forecast that will continue into next year. That 3.5% is a growth in the number of medications that we pass out to the people of Aberdeen City. 1% of the growth is related to price pressure. What we are hoping to do is understand better by using prescribing detail from our GP practices around what we're prescribing that medication for. There's a really good team that work in prescribing that help us understand how we can reduce our overall costs in the prescribing area. But to be more proactive, we need to get a better understanding of what we're actually prescribing for, which health conditions. Proposal for next year is to look at, if you like, an area of deprivation and an affluent area, and understand the differences between those two areas, and particularly focusing on the prevention agenda. What could we do differently? What will that information show us? And I think that's a really strong step forward into understanding prescribing in a different manner to that we have just now. In terms of, I think you mentioned the overall prescribing costs. Sorry, didn't write that question.
Sorry, it was just the percentage of overspend as compared.
Oh, okay. So for prescribing, just our overall overspend, so we're looking to make just slightly over 3% of savings on our total spend for next year.
Fiona, yeah.
I just wanted to pick up a bit that Richie had asked about the vulnerable people. So absolutely, it is our priority to protect those that need services and protect our vulnerable people that live in Aberdeen City. I think we've absolutely been doing that collectively as an SLT. So our senior leadership team have been around all the conversations that we're having to make sure that we're not having any unintended consequences by the decisions that we're making. Ensuring that is always our key thing, as our priority of protecting the most vulnerable, Richie. So a lot of work has been done with that, with SLT and those wider teams that all deliver the services, because we absolutely have to listen to the staff that do the hard work and do the day-to-day work. So we make sure that the decisions we are making are influenced by them, so we don't have any unintended consequences and harm that could occur that we haven't thought through. But our absolute priority is that protection of the vulnerable. Thank you. Thanks, John.
Okay, if I can just add on prescribing, I think in Aberdeen City, traditionally we've been quite good in terms of the level of generic prescribing and quite good in terms of the level of not prescribing things of limited clinical value. So we've probably taken a lot of the low-hanging fruit already. I know, talking to other IJB chairs and vice chairs, which I do on a fairly regular basis, prescribing costs are a worry for quite a few of the others, but I think we're probably in a better position than a number of our counterparts. So, and then Martin.
Thanks, Chair. This is a point that's maybe been already touched on about the priority of looking after those who are most vulnerable, those who are most at risk. We're looking at, I think, a very realistic, well-managed budget to get us through the forthcoming couple of years. It's taken a lot of very hard work to identify savings and so forth. But these are quite significant savings. So I mean, it would be quite reassuring to have information that we are protecting the most vulnerable, that essential services will be protected, will still be available to those who are most at need. I think that would be very reassuring for us and for the public to know that.
Thank you, Martin. Absolutely. So we will be using our eligibility criteria to ensure that the decisions we're making are based on the best evidence and the risk assessed care that they've had. So we will absolutely be using our eligibility criteria to ensure that the decisions we make we can justify why the decisions we're making are to do and to enable us to protect that services of the vulnerable. So our eligibility criteria is the key document for us.
Right. Thanks for that. And if I could come back, we have outlined a strategic plan 25 to 29. There's a lot of very ambitious targets embedded within that. We're looking at trying to step up the prevention agenda. We're trying to look at transformation projects and so forth. A lot of this is quite bold, and at a time of economic pressures, that's not always when you have the most flexibility and you feel most free to explore alternatives. So, is it possible to get a sense of how that strategic plan will involve some quite serious, maybe radical thinking to get us through the budgets up to 2029, and within that it'd be useful to know at what point will we be able to have a slightly more stable reserves position, because I think that would be incorporated within the strategic plan. That is essential, that we get back up to a more reasonable level of reserves.
I'll start and then I'll let Amy come in on the reserves bit, because that's definitely her forte rather than mine. But absolutely, I think that we're very cognizant in health and social care that we need to do transformation. It's been spoken about for a number of years, but I think the time is absolutely, we have got our burning platform and we have to do something really different. I think our strategic plan is giving us that opportunity to really think about what do we need to do differently. We've reduced the size of our strategic plan. We've reduced the size of our priorities to really enable us to focus on making a difference. Because if we have too much, we're never going to deliver. And I think that's the key thing for us. I always say to the team that we are delivering decisions that were made a many number of years ago. I guess what we're trying to do is absolutely future-proof health and social care for Aberdeen City and the population that we're here to serve. And I think our strategic plan will start us on that journey. It will be the beginning of our journey, Martin. It's not going to be easy, but I think that transformation and reform that we absolutely need to do to give us a sustainable service is there, and we're definitely up for the challenge that it's going to give us. Thank you.
And I think that from a finance perspective, we're prudent, we don't take a huge amount of risk. And I think that's a sensible approach, and particularly when we're looking to protect care services. We see an improvement in each of the subsequent financial years through making that change towards stepping into stronger prevention activity. So we see an improvement in financial sustainability, but certainly with a requirement for support for a few more years, you can see that. But I think over the course of the next 5 to 10 years, we hopefully will be successful in the approach to become sustainable within and live with more within our means, we would hope. Thank you.
Mark, you want to come back in?
Yeah, I just really want to come back in on that transformational work and just, reiterate that we are working in partnership here, and that NHS Grampian Board already have a strategic change board, which obviously we want to collaborate with. I think, Fiona, you are a member of that board. And I think that has to be done in partnership and collaboration, because we can't have two systems in opposite directions if we want to transform. And it's going to take time, there's no doubt of that. But if we don't do it, we'll be sitting talking about this in 10 years' time and being exactly the same situation. So I think that's just a word from NHS Grampian's point of view as well. Thanks.
Hussein?
Thank you very much. I want to go back to the point about transformation, if I may, and perhaps if I can just ask for a bit of reassurance, because we are asking for some very major transformative pieces of work going on. Our staff are already working their socks off as it is to meet the unmet needs within the community. And we know, for example, within primary care, that they are already feeling the pressures around, for example, some of that work around prescribing and changing patient behavior and looking at medications of low clinical value. So just a bit of reassurance as to how we are engaging with our staff to make sure that they feel supported to do this, and where necessary that we are putting in the appropriate resource, both in terms of finance and in terms of well-being, that they're able to do that effectively and to undertake the work that we're asking of them.
Thank you, Hussein. And I guess, yes, I would like to give you that reassurance that we're absolutely doing this with our staff, and we have a fantastic transformation team that will be supporting them to enable us to deliver it, because we absolutely are aware that it's people on the front line that will be able to make the right decisions to make sure that that change is sustained and the right changes that we're making. So we can't expect them to do that on top of their busy day jobs. So we have a team of people who are skilled and have the appropriate knowledge and skill base to ensure that we do that change and it's the right change that we make. So that team are already there. I agree, and I'm seeing Sandy and Alison both in my eye line at the minute, and Sandy will never let us forget about how important the well-being of our staff is. So absolutely, we need to make sure they're coming with us. We've been doing some town hall kind of budget workshops with them, and that's opened up to all of our staff, and we've had up to 120 people attend that. And that's really to get them understanding why we are where we are, what we're trying to do, and to enable them to have a strong voice round about it, because they absolutely need to influence this. We can't make this, I can't make this decision, SLT can't make this decision. We have to do it with our staff. And that well-being is so important to that, Hussein. So definitely doing it together. It is not a group of small people in a small number of people in a room. It's absolutely collectively working across Aberdeen City Health and Social Care Partnership. And as Mark said, working with our partners and having that conversations to make sure that we're doing the best for people, and also to prevent any sort of postcode lottery. I meet every week with the chief officers for the other two health and social care partnerships in the Grampian region to enable, we're doing that shared learning, and we're also taking that opportunities that they're maybe doing some good work that we haven't considered yet. So we're doing that collectively to ensure that we're giving a fair service to the whole of the region as well. Thank you.
Did you want to go ahead and go? No. Okay. Any more questions, comments? Lee?
Thank you very much, Chair. Just following on from that, sometimes when we make budget savings in a certain area, we inadvertently kind of increase the impact on other areas. I know this is mentioned kind of throughout the integrated impact assessment, and I just wanted reassurances that we have taken that sort of risk on board. Examples given are increased impact on carers, increased then potentially waiting lists on mental health services, and just wanted to see that we've taken a sort of full broad kind of picture on this. Thank you.
Yeah, thanks very much. I think in the consideration of the budget, we're very careful to take a whole systems approach, because it would make no financial sense to make a saving in one area only and to increase costs in another. And we've got that confidence in the way they've presented the budget that doesn't occur in the budget that we've taken forward. I think the integrated impact assessments are a good guide to highlighting where there could be risk, and the actions that we've taken hopefully mitigate that fully. Thanks.
Okay, any more questions, comments? Not seeing any hands. Okay, I think these questions is quite a good one. Well, I think when Amy talks about the whole system approach, one of the reasons high up in our things that we're going to protect and preserve are we're protecting the number of residential care beds, which has a knock-on effect. It's good for the people who need them, but it has a knock-on effect on inpatient care ARI, which has a knock-on effect at A&E and ARI, which has a knock-on effect at on the Scottish Ambulance Service. So we are trying to take the whole system approach. And again, we've also preserved and protected counselling services around mental health, because that was one of the things that we were really, really keen to do. In terms of, if there are no more questions, my only, oh, Lee, do you want to come back?
Sorry, Chair, I just wanted to clarify that I'm absolutely aware of all this and really impressed by it, and I just wanted to basically kind of bring it forward into the meeting. So yeah, I really am impressed by what's the integrated assessment impact is seen and what we are protecting. Yeah.
Thanks for that. Councillor Malik, want to come back in?
Thank you very much, Convener. If there are no more questions, I have an amendment, and I would be grateful if somebody can second me formally so we can have a healthy debate and the democracy can take place.
Can we see your amendment first, please?
Excellent. Thanks very much. It is with the officer can be circulated. Thank you.
Yeah, can we take just a 10-minute recess so that Hussein can actually see what the amendment says, because he hasn't got his laptop with him.